What's up, everyone? Welcome back to the channel. If you're preparing for your NREMT or just started your EMT basic clinicals, there is one section you absolutely cannot afford to mess up: pharmacology. Today, we are breaking down every single medication in the EMT-B Scope of Practice. We're covering the indications, the dosages for both adults and pediatrics, and the must-know contraindications that could save a life and your license. Let's get into it. EMT Basic Medication. Reference Guide 1. Oxygen. The intervention used for hypoxia, low oxygen levels in the blood, respiratory distress, or suspected carbon monoxide poisoning. Dosage, adult and pediatric. Nasal cannula, a thin tube that rests under the nose, 1 to 6 liters per minute. Non-rebreather mask, a face mask with a reservoir bag, 10 to 15 liters per minute. Bag valve mask, BVM, a handheld device used to provide breaths, 15 plus liters per minute. Contraindications, none in the emergency setting. Do not withhold oxygen from a patient who needs it. 2. Oral glucose. The intervention hypoglycemia, which simply means low blood sugar. This is for the conscious patient with a history of diabetes. Dosage, adult and pediatric. 1 full tube, usually 15 to 25 grams, applied buccally. This means you rub it on the inside of the cheek between the cheek and the gum. Contraindications. An unconscious patient or anyone unable to swallow or protect their own airway, risk of choking. 3. Aspirin, ASA, acetylsalicylic acid. The intervention, chest pain that suggests a myocardial infarction, which is the medical term for a heart attack. Aspirin prevents blood clots from getting bigger. Dosage, adult. 162 milligrams to 324 milligrams of baby aspirin chewed. Chewing helps it enter the bloodstream faster. Dosage, pediatric. Contraindicated. Never give to children due to the risk of Reye's syndrome, a rare but serious condition that causes swelling in the liver and brain. Contraindications, known allergy to aspirin or an active gastrointestinal GI bleed, stomach ulcers, or internal bleeding. 4. Nitroglycerin, nitro. The intervention, chest pain associated with angina, chest pain caused by reduced blood flow, or a heart attack. It is a vasodilator, meaning it opens up the blood vessels to let more blood reach the heart. Dosage, adult. 0.4 milligrams, tablet or spray, administered sublingually, under the tongue. You may repeat every 5 minutes for a maximum of 3 doses. Dosage, pediatric. Not typically administered to children by EMTs. Contraindications, systolic blood pressure, the top number, below 100 millimeters of mercury, use of erectile dysfunction. D. Medications like Viagra or Cialis within the last 24 to 48 hours, or a recent head injury. 5. Epinephrine autoinjector, EpiPen. The intervention, anaphylaxis. This is a severe, life-threatening allergic reaction that causes shock, dangerously low blood pressure, and respiratory distress. Dosage, adult. 0.3 milligrams injected intramuscularly, IM, which means into the muscle, usually in the outer thigh. Dosage, pediatric. 0.15 milligrams for patients weighing less than 30 kilograms, 66 pounds. Contraindications, none in a life-threatening emergency. 6. Albuterol, metered dose inhaler, MDI or nebulizer. The intervention, bronchospasms, which is when the airways in the lungs tighten up. Common in asthma or chronic obstructive pulmonary disease, COPD. Dosage, adult. 2.5 milligrams mixed in 3 milliliters of saline via a nebulizer, a machine that turns liquid into a mist, or 1 to 2 puffs of a personal inhaler. Dosage, pediatric. Same as adult, 2.5 milligrams in 3 milliliters saline. Contraindications, tachycardia, an abnormally fast heart rate, or chest pain that is coming from the heart rather than the lungs. 7. Naloxone, Narcan. The intervention, Suspected opioid overdose where the patient has respiratory depression, they are breathing too slowly or not at all. Dosage, adult, 2 milligrams to 4 milligrams administered intranasally, IN, which means sprayed up the nose using an atomizer. Dosage, pediatric, 0.1 milligrams per kilogram administered intranasally. Contraindications, if the patient is breathing adequately and can protect their own airway, Narcan is not needed. 8. Activated charcoal. The intervention recently ingested poisons or drug overdoses. It works through adsorption, which means the poison sticks to the charcoal so the body doesn't absorb it. Dosage, adult and pediatric, 1 gram per kilogram of body weight. Average adult, 25 to 50 grams. Average pediatric, 12.5 to 25 grams. Contraindications, altered mental status. The patient is sleepy or confused and might choke. Or if they swallowed acids, alkalis like bleach or petroleum products.
All right, we've covered the meds in your bag, but now we need to talk about the most critical condition you will face as an EMT shock. In the medical world, we call this hypoperfusion. Simply put, it means the body's cells aren't getting the oxygen and nutrients they need to stay alive. If you don't recognize the early signs of shock, your patient won't make it to the hospital. Before we look at the different types, like the pump failing or the pipes leaking, we need to talk about immediate treatment. To do that, we use the acronym BOLT. This is your rapid-fire checklist the moment you suspect a patient is crashing. Let's break down how to save a life when every second counts. How to treat shock. The BOLT acronym. You are likely thinking of BOLT, which is a common memory aid for the immediate steps an EMT takes to treat shock. B. Blankets. Keep the patient warm. Shock destroys the body's ability to regulate temperature, thermogenesis. O. Oxygen. Provide high-flow oxygen via a non-rebreather mask, 15 liters per minute, to ensure the blood that is moving is fully saturated. L. Legs. Elevate the legs 6 to 12 inches, Trendelenburg position. This helps move blood from the lower extremities toward the vital organs, heart, lungs, brain. Note, do not do this if you suspect spinal or leg fractures. T. Transport. Shock is a load and go situation. The definitive treatment for many types of shock is surgery or advanced hospital care. The 4 main categories of shock. To remember the types of shock, many EMTs use the acronym REN-CHAPS, but they generally fall into 4 main pipes and pump categories. 1. Hypovolemic shock, low volume. What it is? The fluid is missing. This is caused by massive bleeding, hemorrhagic shock, or severe dehydration from vomiting/diarrhea. How to know? Look for signs of trauma, dry mucous membranes, and flat neck veins. 2. Cardiogenic shock, pump failure. What it is? The pump, heart, is broken. The heart cannot squeeze hard enough to move blood. This often happens after a myocardial infarction, heart attack. How to know? The patient may have chest pain, pulmonary edema, fluid in the lungs causing crackling sounds, and jugular vein distension, bulging neck veins. 3. Obstructive shock, blockage. What it is? Something physical is blocking the blood from flowing. Examples: tension, pneumothorax, a collapsed lung that pushes against the heart. Cardiac tamponade, fluid build-up in the sac around the heart that squeezes it shut. How to know? Look for a tracheal shift, the windpipe moving to one side, or muffled heart sounds. 4. Distributive shock, pipe failure. What it is? The pipes, blood vessels, suddenly get too big, dilate. There is enough blood, but it's sitting in wide-open vessels and isn't under enough pressure to reach the brain. The 3 sisters of distributive shock, anaphylactic, severe allergic reaction, Look for hives, wheezing. Septic, severe systemic infection. Look for high fever and warm skin. Neurogenic, spinal cord injury that cuts off the brain's control of the blood vessels. Look for a line on the body where skin goes from pale, sweaty to warm, dry. The stages. How to know it's happening. Stage 1. Compensated shock. During this initial phase, the body is fighting to maintain blood pressure. You will notice an increased heart rate, also known as tachycardia. Tachycardia. The patient's skin will often become pale, cool, and clammy, and they will likely appear anxious or restless. Stage 2. Decompensated shock. This is a critical turning point where the body's defense mechanisms are failing. The most significant sign is a falling blood pressure. But remember, a drop in blood pressure is a late sign of shock. You will also see labored breathing and cyanosis, which is a bluish discoloration of the skin and lips caused by a lack of oxygen. Stage 3. Irreversible shock. At this final stage, cell and organ damage is too great to recover. The patient will become unconscious, their pulse will disappear, and eventually, this leads to death. Rapid intervention in the earlier stages is the only way to prevent this outcome.